traveled to Denmark to get a glimpse at the kind of home care Canadians say they want. What is it that you find so interesting here?
It's a system that had the same problems that we had in Canada, but they took a completely different approach.
Our guide, Dr. Sameer Sinha, one of Canada's leading geriatricians and policy advisors on elder care.
Denmark spends the majority of its funding on providing care in people's homes because fundamentally it's what people want and it's the more economically sustainable approach.
Their model, says Sinha, is one Canada should adopt. 5 years ago, Margot Algie was diagnosed with ALS, a disease that attacks the central nervous system.
You're good?
Yeah, I no longer walk. My speaking is slowing down. Soon I'm going to not be able to swallow or breathe.
It's taking away her ability to care for herself, so home care workers come to help with everything from getting out of bed to toileting, showering, and fixing a meal.
Oh, great, thank you.
But the home care Margot is able to get is so limited she's often out of bed for just an hour or two a day, or she's told no one can come at all.
I'm terrified when they say I can't have help. Okay, bye.
Without home care, Margot's only other option, going to a nursing home, something she dreads. And she's not the only one.
We know that doesn't align with what aging Canadians want. Almost 100% want to stay in their homes as long as possible.
A recent study published by the Canadian Medical Association found the cost of caring for Canada's aging population is set to almost double in the next 10 years.
What we've had for a long time is a lot of tinkering around the edges, a lot of band-aids, but we haven't really had that deep transformative plan about where our population is going.
The transformation we need, says Sinha, shift priorities away from building nursing homes and towards home care.
Right now we have a system that's geared towards building more beds. What I'm proposing would actually save us billions of dollars more and provide more people what they actually want and need.
Here's how it breaks down. To care for a person in long-term care costs about $200 a day. Home care for a high-needs person costs less than $100. Sinha laid it all out for the Ontario government 4 years ago, but says no one listened.
We committed $6.4 billion to build 30,000 new long-term care beds by 2028.
They chose, the solution that frankly is a lot more costly to taxpayers, but works really well for developers.
You're saying our entire approach is driven by developers and their bottom line. That's why we build long-term care and we don't support home care sufficiently.
Yeah.
But this week, on the verge of the next election, a new promise.
Government is planning to invest $1 billion more over the next 3 years to further expand home care.
Beautiful.
Dr. Sinha has some ideas on how home care money could be spent. Slow the growth of nursing homes and focus on improving home care, like they've done in Denmark. Here, Johnny Olsen gets care in his home 6 times a day. Possible because helping people age at home is a priority.
The goal is to strengthen his legs and make him walk better.
Unlike in Canada, all PSWs are trained to do rehab. It's all about prevention here. Spend early to keep people out of more expensive care later.
Hello.
Camilla Hovland manages home care for the region.
We have developed our home care from the last about 15 years to act more about rehabilitation, so that they actually maybe can take the bath by themselves or go to the kitchen and make their own food or what it may be.
Another preventative approach, everyone in Denmark automatically gets a home care visit once they hit 80.
We are saving money because if we get into the elderly's life before they need help, we can keep them from the help longer than if we don't get in.
Innovative ways to deliver home care is key, like this development, the House of Generations. Here, Here, families, students, and folks needing home care all live in one apartment complex. People support each other.
How can you not love this, right?
We just came up from enjoying the company of little children.
I love it. My neighbor is a young student, and the next neighbor is a young family with a baby.
You have a neighbor who goes grocery shopping for you?
Yeah, if I want it, I can call them.
My best friend is Johanna. She is 90 years old. If we haven't seen each other for a day, she calls me. Are you alive? Yes. Are you? I'm only 50. You're 90. No. No.
Is there science behind what we're seeing here?
Yeah, there's an incredible amount of science showing that it really helps to stave off social isolation and loneliness amongst both sides of the generational span, but also improves health and well-being outcomes as well.
Knock, knock. Hi, nice to meet you. I'm Erica.
It seems this apartment works really well because your chair can get anywhere.
Yes.
Apartments at the House of Generations have mobility aids built in to make home care possible right on site.
How often do you have somebody come in?
6-7 times in a day.
An amount that's unheard of in Canada, where recipients are lucky if they get one visit a day.
What do we need to get to this point?
We just need the political will that we've seen in this community, and really we have living proof that this can actually work already.
Sit. Good girl.
Margot hopes politicians are listening.
It's a really important part of our daily society.
The time for change, she says, is now.
Okay, so Erica, we just heard Ontario's Ford government promising another $1 billion for home care if re-elected in a few weeks' time. How about the other parties?
Well, the provincial NDP say that they too, if elected, will invest another $1 billion in home care, and the provincial Liberals say if they're elected, they'll invest $2 billion. So lots of promises all round.
Right, and yet it's not just about spending more money, is it? The differences we see in Denmark.
No, it's really about reprioritizing the money that we do spend. But fundamentally, Andrew, the big difference between Denmark and Canada is how older people are viewed. You know, when I was there, many people said to us, we don't call our old people seniors or elderly. We call them citizens because they're viewed as important, vital members of society. And so that carries on into programs where they respect their older people. Also, a lot more respect in Denmark for the workers. They are paid more, and that helps retain staff, a big problem we have here in Canada.
Erica Johnson, thank you very much.
Thank you.